We're speaking today with Dr. Alain Moreau, the new director of the Network for Canadian Oral Health Research, also known as NCOHR. NCOHR initiates and supports innovative and collaborative oral health research by promoting mentoring of the next generation of researchers, facilitating the creation of interdisciplinary research teams, and enabling the sharing of research-related resources. Dr. Moreau was appointed on October 1st of this year for a 3-year term. Dr. Moreau, thank you so much for taking the time to chat with us today. Can you tell us a bit about your background?
First of all, thank you very much, Geneviève, for the opportunity to introduce myself to the community. I'm a full professor at the Faculty of Dentistry of Université de Montréal. I'm also cross-appointed at the Faculty of the Medicine of the same university. My field of expertise is in molecular genetics of musculoskeletal health diseases. I'm doing research from cells to animal model, including clinical research with humans. I'm well known for my work on idiopathic scoliosis, as well on osteoarthritis, osteoporosis, and more recently, I developed a new research program on the myalgic encephalomyelitis. So these 4 diseases are very complex and chronic diseases, and they have a strong oral health component as well, which is not very well studied so far. So I think I'm well placed to understand the challenges that we have to face, especially in the oral health research community, about complex diseases. And NCOHR is covering a unique landscape of disease from newborn up to aging populations. And this offers us a lot of challenges, but also a lot of opportunity to contribute to improve health of Canadians.
And you are the first non-dentist in over 100 years to serve as co-director of the dentistry department at St. Justine University Hospital in Quebec. How did you develop those relationships with dentistry?
First of all, that was not something planned in my career path. I've been invited to play that role a few years ago by the dean at that time, who was Dr. Gilles Lavigne, and the general director, Dr. Fabrice Brunet, to rebuild and see what we can, or what we need to develop to have a state-of-the-art department. And the fact that I was not a clinician gave me more latitude and times to develop that kind of planning that is required to rebuild a department. So I learned a lot. That was a great experience. And I have to face a lot of challenges. So that gave me the opportunity to interact with the 42 pedodentists in Quebec. And I would say that a lot of them that asked my response positively to my invitations and contribute to rebuild this department. So far, this experience led us to develop now a Center of Excellence in the pedodentistry. And we are very confident for the future. And now we have a strong department that can give the state-of-the-art care, as well as further able to sustain innovative research and also innovative teaching in pedodentistry.
Interesting. And what would you say are your objectives for the next 3 years with NCOHR?
I think we have to be ambitious at some point. NCOHR is a unique network if you compare with other type of network in Canada, because as I said before, we're covering a large spectrum of disease and a large spectrum of population, so from newborn up to aging people. And that gives us a lot of challenges because dentists as well as researchers in the oral health field are facing on a daily basis those challenges. So we need to play a role of catalyst to bring together educator, clinicians, researcher. And when I said researcher, we have to consider a huge landscape of research from pain toward different bone and diseases, including regenerative medicine, development of new devices, nanotechnology. So this is quite unique for oral health research. So that's why we are in very good positions to improve health of Canadians. And that will be the role of this network in collaboration with different partners, and that include the Canadian Dental Association as well.
Talking about partners, one of NCOHR's mission is to facilitate communications between knowledge creators and knowledge users. This is a mission that NCOHR shares with CDA. So how do you envision our collaboration for the next 3 years?
I think we have quite the very same goals, and by developing a very close collaboration with CDA and other partners as well, including industries, I think we have to make sure that no innovation is left between two chairs, which I mean that we have to bring solution and make sure the solutions are available to clinicians as well as available to the population. And to doing that, we cannot do that alone. We need each partners that will contribute to these common goals. So this is why we really want to hear about the needs of clinicians as well as the needs of the population. And CDA is in good positions to help us to achieve that.
Dr. Moreau, we look forward to pursuing our collaboration with NCOHR within the next few years. Thank you so much for taking the time to talk with us today.
Thank you, Genevieve, for having me and giving me the opportunity to introduce NCOHR and myself. Thank you.
Thanks.